Our back to school coverage continues tonight with an in-depth look at how all three Valley school districts are addressing the fentanyl crisis. Karen has been covering this extensively, and tonight she's showing us how educators are trying to take a proactive approach. Karen.
Well, John, my in-depth report, Fentanyl Safety in Schools, shows Valley School District's response to the crisis and how they've added the medication naloxone or Narcan used to reduce overdose on every campus.
And no one is safe from it. Not you, not me, and certainly not our children.
Educating kids about the dangers of drugs is nothing new. The Reagan-era War on Drugs and Just Say No campaign in the 80s flooded communities with information led by former First Lady Nancy Reagan. In fact, in 1982, I was a senior in high school and was selected to be a part of a panel discussion with Mrs. Reagan, telling kids they have a choice when it comes to the use of drugs and alcohol. Fast forward 40-plus years, and the risks associated with drug use in teens continues. And with fentanyl in the picture, the stakes are higher than ever. But what's different now?
20, 30 years ago, people could experiment with drugs. And now you can't experiment because you don't know what that drug is going to be laced with.
Driving the concern, as I've recently reported, the Coachella Valley has the most fentanyl-related overdose deaths than in any other part of the county so far this year, making drug awareness a priority.
We have it embedded in the curriculum for middle school and high school and even our elementary. Elementary is very different. It's just your basic, safety of medication, because we now know fentanyl can come in and look like candy.
The district has also partnered with a local doctor from Eisenhower Health and Ronnie's House, their Forever 18 fentanyl awareness program.
We teach them about the difference of fentanyl, pharmaceutical grade or illicit. We teach them about not putting their life in the hands of their friends, self-medicating, making good choices, and kind of give them a platform to understand really what it is.
The crisis so prevalent, the California Department of Public Health issued a statewide standing order to increase access to the life-saving medication naloxone, commonly known as Narcan, used to reduce opioid overdose. All three school districts have added Narcan and training on how to use it.
Administration has been trained, health service techs have been trained, and anyone that volunteers, security, front office staff. Over the summer, we were able to train 80 paraprofessionals. Also, staff from transportation has been trained.
Narcan is a nasal spray. 2 come in a box, and it's quick and easy to use in case of an emergency.
It goes in the nostril until your fingers touch the end of the person's nose. And then it's a quick click.
That should restore a person's breathing and give time for first responders to render aid. While Narcan is available in case of an emergency, all districts are proactive in pushing to educate students before a crisis happens. Palm Springs Unified says they are working to partner with Riverside University Health System, holding presentations and assemblies for some of the staff and students. Desert Sands added a QR code to the lanyards that middle and high school students are required to wear this year that takes them directly to information on the dangers of fentanyl from the district attorney's office.
Lots of times students don't want to have that conversation out loud with an adult, even a trusted adult at school. They sometimes want to have a little more anonymity.
And she went on to say that all students have phones, so that's the best way to reach them. I want to point out that all three districts say they have not had a situation where they have had to use the Narcan on school campuses so far. If you'd like to see more of my stories on the fentanyl crisis, head to KESQ.com.